today we're located in the St. Elizabeth Community Clinic, which is located in the Ascension Parish Health Unit in Gonzales. And this is a very unique, for Louisiana I think, a unique public-private partnership between parish government and a local hospital to provide health care services to the people in our community. And today we have with us the President and CEO of St. Elizabeth Hospital, Mr. Robert Burgess, and the President of Ascension Parish, Mr. Kenny Matassa, and they are both intimately involved in this partnership. Good morning, gentlemen.
Good morning, Martin.
Robert, can you give us a little background about how we came to be here, what's going on?
Sure. In 2009, President Matassa was head of the health unit then, and he and the former CEO, De Lejeune, came up with an idea of a public-private partnership to serve the uninsured residents of Ascension Parish. So in 2009, we received a grant from the Franciscan Missionaries of Our Lady for a 3-year funding of this clinic in partnership with President Matassa. And since 2012, it's been totally funded by St. Elizabeth Hospital. We keep a primary care nurse practitioner here and some staff members. We serve about 3,000 uninsured residents a year, and we provide primary care and diagnostics and referrals, and we also refer to the Gonzales Mental Health Unit. So we're the first stop for people to get well.
Thank you, Robert. And President Matassa, everybody credits you with having the idea to get this started in the first place. How did it come about? What was going on at the time?
Well, you know, we had people that were uninsured, that didn't have money to go to the doctor. They were going to the emergency room, so that was putting a burden on St. Elizabeth. And I had a dream, and at the time got with Miss D, and the dream came true, and it was a big win for the people of Ascension Parish. But way back when Bobby Jindal was in, I talked to him and I talked to this former governor that if around the state the government would get with the hospitals to do community clinics inside the health units, that would save a lot of money and give good service to the people. Like Robert said, we've got 3,000 people that come here. They can use that extra money that they don't pay to a regular doctor to spend in the parish and take care of their families.
Right, and so people are coming here. The uninsured people can come here to have primary care treatment instead of having to go to the emergency room. Yeah.
That's correct, Martin. Not only do they come in for the initial visit, but they can continue to get primary care by coming here. If you think about some of our folks that visit here have been to the emergency room 20 times a year because that's their only source of medical care. Instead, they come here in a much more pleasant environment and get the care that they need, and that stops disease, and we especially focus on hypertension, diabetes. So we're stopping people from getting sicker just by coming here.
And now we are in a newly renovated wing of this building. The parish government took a whole wing of the building and renovated it into very modern examination rooms, laboratory. What can you say about that, Fred?
Well, for about the past 10 years, Ascension Parish has been running most of the health department. The state is still visible in checking the sewer and the restaurants and stuff like that. And to make it run a lot smoother, I put them in another building around the side and renovated the whole side for St. Elizabeth, which we have dedicated. We paid for that expense, and St. Elizabeth pays for labor and everything else. And I also want to say that every now and then a person needs a specialist, and the doctors that St. Elizabeth had, they see some of these on their own nickel. So it's a great partnership, and we're just happy to do it with St. Elizabeth, and it's a win-win for the people of Ascension Parish.
And it's a wonderful facility. We're located directly across Worthy Street from the Gonzales Courthouse, the Ascension Parish Annex Courthouse, and it's very convenient. We're also right next door to the Ascension Parish Mental Health Unit, and I'm told that they can help people. They'll work with both of the patients in each clinic to apply for Medicaid. Yes.
Well, that's true, but I think the big thing is they come here when they're seen by a nurse practitioner and they see they have some other problems. they hook them up with next door at the mental health, and it could be substance abuse or just any kind of disorders in that area. So it's a great partnership.
And Robert, we can't tell you how much we appreciate St. Elizabeth being here. You got the grant money to get it set up in the first place. St. Elizabeth is really involved in the community. You're a great partner to have in Ascension Parish.
Well, thank you, Martin and President Matassa. Our mission is to serve those most in need, and we think that this partnership that we have here is a great example of how you do that, serve those most in need.
So this is the Ascension Parish Health Unit, coupled with the St. Elizabeth Community Clinic on East Worthy Street in Gonzales, very centrally located to provide health care to the people of Ascension Parish who need it the most. Thanks for joining us, and come by and see us.